Chikungunya virus outbreak. WHO warns of global epidemic risk in 2025. Global health crisis looming. WHO issues urgent warning about chikungunya virus spread. The specter of a worldwide chikungunya epidemic has prompted the World Health Organization to sound emergency alarms this Tuesday, urging immediate international response to contain what could become a devastating global health crisis. Experts at the WHO have identified troubling patterns that mirror those observed before the massive outbreak 2 decades ago, a clear red flag that demands swift preventative action before history repeats itself with potentially catastrophic consequences. Chikungunya, though not widely recognized by the general public, is a mosquito-transmitted viral infection that inflicts excruciating joint pain and high fever on its victims. These symptoms can be crippling for sufferers, and in certain instances, the disease proves fatal. But here's what makes this situation particularly alarming. The virus has already established presence in 119 nations worldwide, placing a staggering 5.6 billion individuals at risk of infection. Most people haven't heard of chikungunya, but its global footprint is enormous, explained Diana Rojas Alvarez, a WHO representative leading the response effort. Alvarez highlighted the concerning parallels to the 2004 to 2005 epidemic, when chikungunya first ravaged small island territories in the Indian Ocean before expanding globally and infecting nearly 500,000 people. The current situation appears to be following an identical trajectory. What we are witnessing today is eerily familiar, Alvarez cautioned during a Geneva press briefing. Since early 2025, major chikungunya outbreaks have been confirmed in Reunion, Mayotte, and Mauritius. The situation in Reunion is particularly dire, with approximately 1/3 of the entire population already infected. The challenge of diagnosis and the spreading threat. Compounding the crisis is the diagnostic challenge presented by chikungunya. Its symptoms closely resemble those of dengue fever and Zika virus, making accurate identification difficult without specialized testing, a critical factor that often delays proper treatment and containment efforts. The geographical spread of the current outbreak is following the same expansion pattern observed 2 decades ago. Alvarez noted that the virus has already jumped to Madagascar, Somalia, and Kenya, with epidemic transmission also occurring throughout South Asia. Europe hasn't been spared either. Imported cases linked to the Indian Ocean island outbreaks have been documented, with France reporting local transmission and Italy investigating suspected cases. This continental spread represents a particularly troubling development that suggests the virus is gaining momentum. We are raising early warning signals so nations can implement preparedness measures, enhance detection capabilities, and strengthen their healthcare infrastructure before facing potentially overwhelming outbreaks, Alvarez emphasized. While the mortality rate remains below 1%, this statistic becomes significantly more alarming when considering the potential scale of infection. When millions become infected, even that small percentage translates to thousands of preventable deaths, Alvarez warned. The tiger mosquito's expanding territory. The primary vectors for chikungunya are the Aedes aegypti and Aedes albopictus mosquitoes, with the latter, commonly known as the tiger mosquito, expanding its habitat northward as global temperatures rise due to climate change. This environmental shift is creating new vulnerable populations with no existing immunity. In regions where people have little or no prior exposure to the virus, chikungunya can spread explosively, potentially affecting up to 75% of the population, Alvarez explained. Unlike some mosquito species that feed primarily at night, these particular carriers are most active during daylight hours, with peak biting periods typically occurring in early morning and late afternoon, precisely when many people are commuting or engaging in outdoor activities. The WHO strongly recommends personal protection measures, including regular application of mosquito repellent and eliminating standing water in containers around homes and workplaces, as these provide ideal breeding grounds for the disease-carrying insects. And this is the part most people underestimate: the role of individual action in preventing a global health crisis. Could your backyard container of stagnant water become ground zero for the next outbreak cluster? Are governments doing enough to prepare for what might become the next major epidemic? What preventative measures do you think should be prioritized in your community? Have you noticed increased mosquito activity in previously unaffected areas? Share your experiences and concerns in the comments. Your observations might help others recognize early warning signs in their own regions. WHO issues urgent warning on Chikungunya outbreak 2025. How to protect yourself. The World Health Organization, WHO, has raised an alarm regarding the resurgence of the Chikungunya virus, a disease transmitted by mosquitoes, which could potentially lead to a global epidemic similar to the one experienced 2 decades ago. This warning comes as new outbreaks, particularly from the Indian Ocean region, are beginning to spread to Europe and other parts of the world. As reported by Diana Rojas Alvarez, a medical officer at the WHO, approximately 5.6 billion individuals across 119 countries are currently living in areas vulnerable to this virus. The Chikungunya virus is notorious for causing severe symptoms such as high fever, debilitating joint pain, and even long-term disabilities. We are witnessing a repetition of history, Rojas Alvarez stated, drawing a comparison to the epidemic that occurred between 2004 and 2005, which impacted nearly 500,000 people, especially in small island territories, before it spread globally. The latest outbreak began in early 2025, with significant cases emerging from the same Indian Ocean islands that were previously affected, including La Réunion, Mayotte, and Mauritius. Alarmingly, it is estimated that about 1/3 of La Réunion's population has already contracted the virus. The Chikungunya virus is now making its way to countries like Madagascar, Somalia, and Kenya, and has also shown signs of epidemic transmission in Southeast Asia, particularly in India. A growing concern is the rise in imported cases and the recent local transmissions occurring within Europe. Since May 1st, there have been around 800 reported cases of chikungunya in continental France. Furthermore, 12 instances of local transmission have been identified in various southern regions of France, indicating that individuals have been infected by local mosquitoes without any travel to endemic areas. A case was also reported last week in Italy. Chikungunya is primarily spread by Aedes mosquito species, including the infamous tiger mosquito, which is also responsible for transmitting dengue and Zika viruses. Currently, there is no specific treatment available for chikungunya, making prevention crucial. Since these mosquitoes are active during the day, it is essential to take preventive measures such as using insect repellent and wearing long-sleeved clothing to reduce the risk of bites. This situation raises important questions. Are we prepared to handle another potential epidemic? What measures can be taken to protect vulnerable populations? The conversation around chikungunya and its implications is just beginning, and your thoughts on this matter could be vital. Share your opinions in the comments below. Chikungunya virus alert. Mosquito bite this monsoon can trigger years of joint pain. Imagine a single mosquito bite turning into years of excruciating arthritis-like pain. That's the alarming reality of the chikungunya virus, which is making a resurgence this monsoon season. The World Health Organization, WHO, has issued a global alert, warning of a potential epidemic that could rival the devastating outbreaks of 2004 to 2005. Diana Rojas Alvarez from WHO notes that early signs are eerily similar to those that preceded the previous crisis. This time, the virus is rapidly spreading in the Indian Ocean islands, parts of Africa, South Asia, and even Europe. Let's dive into what this warning means, the impact of chikungunya, who's at risk, and how we can protect ourselves. Poll ***. Which preventive measure do you think is most effective against chikungunya? Eliminating stagnant water sources. Using mosquito repellents and protective clothing. Understanding chikungunya. More than just a fever ***. Chikungunya is often confused with dengue or Zika due to overlapping symptoms, but it brings its own set of severe challenges. Transmitted by the Aedes aegypti and Aedes albopictus mosquitoes, the same vectors for dengue and Zika, chikungunya stands out for its intense joint pain. The name, derived from the Makonde language, means to become contorted, reflecting the sufferer's hunched posture due to extreme joint stiffness. While the illness typically lasts 7 to 10 days, joint pain can persist for months or even years, resembling arthritis. Symptoms. The real deal when infected. According to the WHO, chikungunya symptoms usually appear 4 to 8 days post-bite. These include 1. Sudden high fever. 2. Severe joint pain, particularly in hands and feet. 3. Muscle pain. 4. Fatigue. 5. Rash. 6. Joint swelling. In rare cases, complications can affect the eyes, heart, or nervous system. The long-term impact, especially on older adults and those with pre-existing conditions, is often overlooked. Persistent joint pain isn't just uncomfortable, it's disabling. Who's at risk, and why it matters now more than ever. WHO's latest assessment reveals that 5.6 billion people in 119 countries are at risk. This includes not only tropical regions but also parts of Europe and Asia, where the Aedes albopictus mosquito is spreading due to climate change. High-risk groups include elderly individuals prone to long-term joint issues, newborns, if infected during birth, people with weakened immune systems, residents of densely populated urban areas with abundant mosquito breeding sites. Recent data from La Réunion shows that nearly a third of its population was infected in 2025 alone. With local transmission now in France and Italy, chikungunya is no longer just a tropical concern. How the virus spreads, debunking myths. Contrary to some myths, chikungunya isn't spread person to person. It's transmitted exclusively through the bite of an infected mosquito, which bites primarily during the day, especially in the early morning and late afternoon. An infected person can be a virus source for mosquitoes for about a week, enabling rapid outbreak escalation. Prevention. What really works? With no vaccine or specific treatment, prevention is crucial. WHO advocates for strong individual and community efforts. Key strategies include eliminating stagnant water in flower pots, buckets, or AC trays, using mosquito repellents with DEET, picaridin, or oil of lemon eucalyptus, wearing full-sleeved clothing during peak mosquito hours, installing mosquito screens on doors and windows, community fogging in high-risk areas. However, fogging alone isn't sufficient if stagnant water remains. Community awareness and cleanliness are the real game changers. Chikungunya today, a hidden climate crisis. There's growing evidence linking the rise in mosquito-borne diseases to climate change. Warmer temperatures and increased rainfall expand mosquito breeding grounds and survival times. A 2024 report warns that rising global temperatures have pushed the Aedes albopictus mosquito further north, reaching previously unaffected areas in southern Europe. This isn't just a public health issue, it's a climate-linked crisis. Public health experts urge countries to enhance disease surveillance, invest in early detection, and prepare healthcare infrastructure for potential outbreaks. But here's where it gets controversial. Is enough being done to address the root causes, like climate change, that are exacerbating these health crises? What are your thoughts? Share your agreement or disagreement in the comments below. This article is for informational purposes only and does not replace professional medical advice. For personal health concerns, consult a qualified healthcare provider.